Hello friends, here is a patient performing blood test. Why? Why is suffering from diabetes? Today we will discuss about total information of diabetes and its management through Ayurveda. The wonder of this disease is that at present in India more than 10 crore, about 100 billion patients are suffering from diabetes, in which 55% are male and 65% female. They are expending about 13,000 per year on the medicines. And wonder is that half of them doesn't know that they are suffering from diabetes. Why? Because they never perform sugar test. And symptoms of diabetes appears after few days. So person doesn't know that he is suffering from diabetes. What is the cause and what is the complication of this? I will discuss about this. I am Dr. Ram Arora, an Ayurvedic practitioner at Ujjain, MP. Mitra, for drying the wheel, we fill the fuel for energy. In the same way, for our life activities, we need energy. So we use is our food for energy, which in presence of insulin converts in the energy which is needed for life activities, physiological activities and physical activities. Insulin is secreted from pancreas. Types of diabetes. Type 1, autoimmune causes. By mistake, our immunity system destroy the pancreas, beta cells of pancreas, which affects the insulin secretions. Type 2 insulin secreted, but it is resistant, not used, means relatively insulin deficiency. Gestational diabetes is another type. It occurs during the pregnancy in females, which automatically after delivery recovered, completed, patient becomes normal, but it may be converted into type 2 diabetes also. What is the causes and risk factors of the diabetes? There are three basic factors: genetics, lifestyles and food habits. Genetics, from ancestors to source. Lifestyle factors, sedentary life, no physical activity, dietary habits, poor dietary habits, wrong dietary habits, obesity, stress. Symptoms are polyphagia, polydipsia, polyuria. Polyphagia, excessive hunger. Polydipsia, excessive thirst. And polyuria means excessive urination. Main three symptoms of the diabetes. Now, complications of the diabetes: heart attack, cardiovascular diseases. In a reports recently published, the country where the diabetic patient is more, there is heart attack is more. 20%, 22% diabetic patients attacked by heart. Neuropathy, nerves becomes defected, tingling sensation and numbness in hands or feet. Retinopathy, eyesight affected. Nephropathy, kidney failure. ED, erectile dysfunctions, less of erection for sexual activities. About 30% of diabetic patients suffered from erectile dysfunctions. Loss of weight, genital itching, tiredness, gum diseases and loss of teeth. Diagnosis: there are tests for diagnosis: fasting glucose test, postprandial oral glucose tolerance, and HbA1c. The main test for the diagnosis of the diabetes. Now, what is the blood sugar level? You see, for normal persons, the fasting blood sugar value from 70 to 100. Pre-diabetic 101 to 126, and established diabetic more than 160 to more than 2. After meal of 2 hours, yani means postprandial normal value less than 140. Pre-diabetic 140 to 200, and diabetic patient more than 200. Hemoglobin HbA1c tests. In normal patient 5.7%. Pre-diabetic between 5.7 to 6.4, and diabetic patient more than 6.5%. This test indicates blood sugar level of about 3 months, average 3 months. Hyper and hypoglycemia. Many times person forgets to take medicines, or overeating of carbohydrates, sugar, etc., where the blood sugar level raises high. Hyperglycemia. Hypo, overdose of the medicines, fasting, starvations, etc. Hypoglycemia, less than normal blood sugar level. Prevention: Avoid fat and carbohydrates in meal. Daily exercises, morning walking, avoid stress, control body weight and control blood sugar. Now treatment, goal of treatment, free from symptoms, polydipsia, polyphagia, polyuria, to control these. Prevention of complications like retinopathy, neuropathy, nephropathy, etc., and improvement of the quality of life. These achieved goal can be achieved by three parts: exercises, lifestyle, and medicines. In Ayurveda, many medicines for these diabetes, which can you use by consultation, after consultation of your physician. Mainly these karela, halli, bilpat, trifla, karela, methi dana, dalchini, jamun, giloy, ashwagandha, etc. Mix these powder in same quantity and take 5 gram morning and evening with water. But you should consult your doctor previously. In this way, Ayurveda is very safe, effective way. So please first try and then believe. Thanks, man. Thanks, man.